Thank you, Chairman. This question is directed to Drs. Fauci and Walensky. In January, an NIH study found that 95% of people who had recovered from COVID had at least 3 out of 5 components needed to recognize the virus up to 8 months after infection. In August, Israeli researchers found that natural immunity can confer longer-lasting and stronger protections against infection, severe disease, and hospitalization resulting from the Delta variant. Rockefeller University found that while vaccination induces memory B cells to evolve over the course of a few weeks, natural infection produces memory B cells that improve for up to 1 year after infection. This is likely because remnants of the virus remain in the body for longer than a vaccine would, which gives the body more time to adapt to it. I understand that it's not all black and white. UK researchers released studies results suggesting that fully vaccinated individuals who had COVID-19 have the highest immunity. Additionally, last week, CDC published a new report that found unvaccinated people who had previously been infected were 5 times more likely to test positive for COVID-19 than people who were fully vaccinated with an mRNA vaccine. My question is simple. What does the science say about the durability of natural immunity, and when can we expect answers on its benefit?
Thank you so much, Senator Burr. The CDC did publish a 96-page paper review in a scientific brief on Friday. I want to be very clear that the CDC continues to recommend that people, after review of that scientific brief, that CDC continues to recommend that people who have been previously infected get their COVID-19 vaccine. We know in our vaccine studies, our vaccine effectiveness studies, with date certain when people were vaccinated, and we can prospectively follow them through our effectiveness studies and our effectiveness cohorts. Through that, we can see the durability with a date certain in vaccines. The data on the infection-induced immunity, some of which you quoted, are murkier. They rely on retrospective studies, observational studies, and studies where we can't do a prospective study. We are following these people. We are following people who've been previously infected in our infection cohorts. But the data and the science are harder. You talked about infection-induced immunity with B cells, memory B cells, and antibodies, but another arm of the immune system, the T cells, are harder to study and harder to evaluate to try and do this in a commercial-type fashion. What I would say is the final study that you cited, which is the study from the CDC that retrospectively looked at a cohort of people who had been previously infected and those who had been previously vaccinated. And as you noted, there was a 5.5 times fold more likely chance of being diagnosed with COVID if you had infection-induced rather than vaccine-induced immunity. And that is among the studies that we reviewed that led to us to our current recommendations.
Dr. Fauci?
Just to add a little bit to that, Senator Burr, the studies you referred to were NIH-funded studies about B-cell and T-cell responses by NIH grantees. It is true that, as a matter of fact, both from natural infection as well as from vaccine-induced immunity, you have not only antibody responses, but you have the development and the maturation of memory B-cell responses and T-cell responses. One of the goals over the next several months, which are currently being done by our grantees, is to determine the clinical correlation between the development and maturation of B-cell and T-cell responses and clinical effect. And we're looking at that both post-vaccination, post-boost, and in individuals who've been infected. Hopefully we'll get more definitive information over the next several months.
Should an individual who has recovered from COVID be exempt from the mandate to be vaccinated, given that they have natural immunity?
CDC recommendations suggest that you have both more durable and robust and known immune response if you are vaccinated after you've been previously infected, and those are our recommendations.
Do children 5 to 11 who have recovered from COVID, should they be vaccine exempt?
Our guidance continues to recommend that children who've been previously infected actually get vaccine. Data are emerging on the impact of natural infection in adults. Our data are still even sparser among children.
How does the concentration of antibodies in a recovered COVID-positive patient compare to an individual 6 months after they've had a vaccination?
It really varies from study to study. The one thing that we do know that's very important when you talk about post-infection immunity is that when you vaccinate a person following recovery from infection, the level of antibodies are considerably higher than post-infection alone and higher than vaccination alone. So the best combination of high degree of laboratory-related protectiveness is if a person who gets infected and recovers ultimately gets vaccinated, and that looks like the most powerful of the protective responses.
Clearly, I understand that from the data. My question on whether a COVID-positive recovered patient should be mandated to take a vaccine. If they've not had COVID, then you take a vaccine to boost your immunity level to a certain degree. COVID-positive patients have already done that. And I'm just telling you, it's a hard sale to tell people who have had COVID that they're now under a mandate by the federal government, to be vaccinated. I think you've got an extremely tough sale to a healthcare professional, doctor, nurse, who had COVID, might have a hesitancy about the vaccine, and I look at what ASPR is required to do to fill in for the healthcare vacancies that exist out there and surge people to it. You start doing this to people, Medicare, Medicaid providers, community health centers, we're not going to have the people to surge, Dawn, from the healthcare professionals that make a decision. I had a natural immunity, I've got some protection, but I don't yet believe I need to be vaccinated. I think we need to think about this. Thank you, Chair.